All right, last video for this week. We're going to get into things that go wrong with bones. We're going to talk about some genetic conditions, problems with nutrition or hormonal disorders. Then we're also going to talk about aging and aging's impact on the bone. So let's talk about some different conditions. So some are probably somewhat familiar, others not so much. But the first one is osteoporosis. This is something that basically you are breaking down more bone than you are laying down. So basically breaking more bone down, you're not building more up. So bone resorption is going to outpace formation. This is going to lead to weakening and fractures in the bone. This can happen for a variety of reasons. Typically we think of age with this and certain factors along with age. So diet, so poor calcium intake, sedentary lifestyle, these are things that can impact your ability or your risk of developing osteoporosis. And then other things that a person cannot control that contribute to someone's risk factor includes if someone is of white or Asian descent, there's a higher risk of developing this. People who are born or an assigned female at birth are usually at a higher risk of this. And then also people who are of a small or like a thin stature. And so obviously a lot of those things are, someone cannot necessarily control, right? They can't control if they were, assigned female at birth or if they were born white or Asian, but things like nutrition and activity level, right? Those are things that can be controlled. Osteopenia, this is when you have this reduction in bone density before osteoporosis. So osteoporosis, we're usually thinking like elderly, but osteopenia, like we're talking early. So we're still talking about over age 55, but that's still early compared to osteoporosis. Rickets or osteomalacia, this is basically there is a deficiency in vitamin D and calcium, especially in children. This can cause deformity and fractures in the bones. One of the common things or one of the hallmark signs is the child developing their bones and their legs developing bow-legged, so their legs kind of bend outward, or becoming knock-kneed where the knees kind of lean in too close to each other. Osteogenesis imperfecta, I mentioned that in another video, so I won't talk about it too much here, but again, it's a genetic condition where the bone is not formed right because of that type 1 collagen deficiency, leading to improper bone formation and lots and lots and lots of fractures. And we talked about some of the things that go along with that make it difficult to live with. Osteopetrosis, this is another genetic condition. This is where the bones basically are too dense and too thick, stunted, often brittle because the osteoclasts are not able to help. And then if we look at aging, right, and this is normal aging, right, this is something that if you get older, right, you're going to go through this, right? If you're not getting older and going through this, that means you're already dead. So, and that's not good. So this is something that, hopefully it happens to all of us because it means that we've lived a long life. But some things that happen or some things that affect our bones are reduced hormone levels, especially with sex hormones. And this is especially important with women with their estrogen levels. So as estrogen drops, remember that OPG being affected, not being able to turn off the osteoclast activity. This results in the loss of calcium. We see demineralization, which can develop into osteoporosis. We have decreased strength and an increased risk of fracture. We also lose height because of it, because the bones compress down. They can't push back against gravity, basically. Your bones compress down, and so you'll notice that as people get older, they actually get shorter. There is a reduced rate of protein synthesis because the thyroid's not functioning the same way, so the matrix components like collagen and whatnot are not produced as much. And so we get a susceptibility to fracture due to bending as well. And again, this is something that we do have to try to fight against. The things that we can do to fight against it are eating a healthy diet, going and exercising on a regular basis to maintain as much healthy bone density as we can, especially as we get older, because if you start with poor bone density, you're going to lose it from there. But if you start with really good bone density because you were exercising and eating right, you're putting yourself ahead of the game there. And then if you do have issues with hormone levels or things like this, there are medications and treatments that you can use that are prescribed by a doctor to help with that.